In this podcast episode, Dr. Paul Conti joins Andrew Huberman to discuss how to improve mental health. They begin by recapping the model of mental health that was discussed in the previous episode, which consists of two pillars, the structure of self and the function of self. The structure of self starts with the unconscious mind, which is like a supercomputer that influences our thoughts, behaviors, and feelings. It is followed by defense mechanisms, which can either be healthy or unhealthy, and the character structure, which shapes how we engage with the world. The self then emerges from this structure. On the other hand, the function of self starts with self-awareness, the awareness of our own existence and the choices we make. It is followed by defense mechanisms in action, which are unconscious processes that influence our behavior. Salience comes next, which determines what we pay attention to. Behavior and strivings are also part of the function of self. Dr. Conti emphasizes that understanding these pillars is crucial for understanding ourselves and improving our mental health. By examining these components, we can identify areas that need improvement and work towards achieving a healthier state of mind. They also discuss the concept of drives, which are intrinsic motivations that guide our behavior. Traditionally, there have been two drives identified in mental health, aggressive drive and pleasure drive. Aggressive drive refers to our forward, active engagement with the world, while pleasure drive encompasses our desire for pleasure and relief. However, Dr. Conti introduces a third drive called the generative drive, which is a drive to create and make things better. He believes that these three drives together contribute to our mental health and well-being. Dr. Conti explains that these drives can vary in intensity among individuals and can be influenced by both genetics and life experiences. When these drives are in balance, they contribute to a sense of agency and gratitude, which are key components of mental health. However, when they are out of balance, it can lead to problems and challenges in our lives. The discussion then shifts to the practical aspects of improving mental health. Dr. Conti suggests that individuals should examine all 10 components of the pillars to identify areas that need improvement. By asking specific questions and exploring these areas, individuals can gain a better understanding of themselves and make positive changes. They also address common challenges people face in improving their mental health, such as lack of motivation. Dr. Conti explains that motivation can be influenced by various factors, including fear of failure or success, childhood trauma, and unconscious processes. By addressing these underlying issues, individuals can increase their motivation and take action towards improving their mental health. The episode continues by emphasizing the importance of understanding the self and the various components that contribute to mental health. Dr. Conti introduces a map that outlines the different aspects of the self and explains that exploring these components can lead to a better understanding of oneself and the potential for positive change. He then delves into a case example of a person who is feeling dissatisfied with their life and is struggling with motivation and fulfillment. The individual expresses frustration with school, loans, and a lack of clarity about their future prospects. They also mention failures in work and relationships, which have left them feeling weighed down and unmotivated. Dr. Conti suggests that the person's lack of enjoyment or gratification in any aspect of their life may indicate an imbalance in their pleasure drive. He also considers the possibility that their generative drive, or the desire to create and contribute, may be frustrated. By exploring these drives and understanding the person's unique situation, Dr. Conti aims to help them find a path towards fulfillment. The conversation then shifts to the topic of individuals who can experience pleasure and keep busy with activities like social media or video games, but still feel unfulfilled and stagnant in their lives. Dr. Conti acknowledges that these activities can provide temporary pleasure, but they may not be generative or contribute to personal growth and progress. He emphasizes the importance of finding a balance between pleasurable activities and pursuing meaningful goals. The discussion continues with a focus on the concept of milestones in life and societal expectations. Dr. Conti mentions the phenomenon of failure to launch, where young people struggle to find their vocation or feel good at anything. He notes that societal pressure to achieve exceptional success can discourage individuals from pursuing their passions if they believe they cannot be the best in their chosen field. However, he also acknowledges that success can be defined in various ways, and there are many paths to a fulfilling life. Dr. Conti highlights the importance of understanding the individual's unique drives and desires. He suggests that the person in the case example may have a higher generative drive than what is being fulfilled, leading to frustration and a sense of stagnation. By helping the person understand themselves and their drives, Dr. Conti believes that positive change can be facilitated. The conversation then explores the role of the unconscious mind and defensive structures in shaping one's behavior and mindset. Dr. Conti notes that the person in the case example had a healthy defensive structure in the past, but it became distorted as they became more dissatisfied with their job. This distortion led to maladaptive behaviors, such as excessive alcohol consumption, as a way to cope with their frustration. The character structure of the individual is also examined, revealing a pattern of understanding and awareness but difficulty in taking action and making necessary changes. Dr. Conti suggests that this pattern may be rooted in past trauma or negative experiences that have eroded the person's sense of agency and self-efficacy. The function of self is explored, focusing on self-awareness and the ability to navigate one's own thoughts, emotions, and actions. Dr. Conti emphasizes the importance of recognizing the I within oneself and understanding one's own needs and desires. By developing self-awareness, individuals can make choices that align with their values and bring them closer to a sense of contentment and fulfillment. Dr. Conti highlights the role of defense mechanisms in shaping our thoughts and behaviors. He explains that defense mechanisms can be healthy or unhealthy, depending on how they are enacted. Acting out, for example, is an unhealthy manifestation of aggression that can lead to self-sabotage and self-destructive behaviors. Dr. Conti emphasizes the importance of recognizing and addressing these defense mechanisms to bring about positive change. The concept of salience is also discussed in relation to mental health. Salience refers to what is most apparent and attention-grabbing in our thoughts and experiences. Dr. Conti explains that salience can be influenced by our internal narratives and external stimuli. He suggests paying attention to what comes to mind during different states of arousal, such as sleepiness or alertness, as well as when there is a lot of competition for attention. By understanding what is salient to us, we can gain insight into our thought patterns and make conscious choices about what we want to prioritize. The podcast delves into the topic of intrusive thoughts, which can be markers of trauma or internalized negative beliefs. Dr. Conti explains that intrusive thoughts can be a result of unresolved trauma or experiences that have been pushed into the unconscious mind. He emphasizes the importance of addressing these intrusive thoughts and understanding their origins in order to overcome them. Dr. Conti suggests that self-scrutiny and reflection can help identify and challenge these negative thought patterns. The discussion also touches on the impact of childhood narratives on our beliefs and behaviors. Dr. Conti explains that the messages we receive as children, whether direct or indirect, can shape our self-perception and influence our choices later in life. He highlights the need to examine these narratives and question their validity. By cultivating self-awareness and separating the internalized narratives from our true selves, we can overcome limiting beliefs and make positive changes in our lives. Dr. Conti outlines a two-part process for overcoming negative thought patterns and internalized narratives. The first part involves examining the givens, or the assumptions and beliefs we take for granted. This includes exploring the unconscious mind and understanding the origins of our thoughts and behaviors. The second part involves cultivating self-awareness and understanding what is truly true for ourselves. By questioning and challenging the internalized narratives, we can begin to change our thoughts and behaviors. One topic that is discussed is intrusive thoughts. Dr. Conti explains that it is common for individuals to have intrusive thoughts, but the key is to acknowledge them and not try to push them away. By looking at these thoughts and understanding them, we can gradually diminish their power and eventually let them go. He emphasizes that this process takes time and effort, but it is possible to overcome intrusive thoughts. Dr. Conti also explores the concept of drives, specifically the generative drive, aggressive drive, and pleasure drive. He explains that the generative drive is pro-social and focuses on nurturing and building goodness. On the other hand, when the aggressive drive and pleasure drive are too high, it can lead to envy, which is destructive. He emphasizes that the goal is to have the generative drive as the dominant drive, with aggression and pleasure serving the generative drive. The discussion then delves into how different levels of aggression and pleasure drive can affect individuals. Dr. Conti explains that when the aggressive drive is too high, it can result in a need for control, which can manifest in various ways such as intimidation, manipulation, or passive aggression. Similarly, when the pleasure drive is too high, individuals may constantly seek more pleasure without finding satisfaction, leading to envy. In both cases, the excessive drives can be destructive and hinder personal growth and healthy relationships. The podcast also explores real-life examples of individuals with high levels of aggression and pleasure drive. One example is a collaboration that was disrupted due to the excessive need for control and the inability to handle disappointment. Another example is a person who dominates social interactions by constantly talking about themselves and exerting control over the conversation. These individuals may appear empowered, but in reality, their behavior stems from vulnerability and a lack of self-worth. Their actions are driven by envy and the desire to be in control, which ultimately leads to destructive outcomes. Dr. Conti emphasizes that narcissism is often at the core of such behavior. Narcissistic individuals may gather people who support their behavior or have no one around them at all. They may exert control over others and seek to prevent anyone from surpassing them. However, this behavior is counterproductive and isolating, as it pushes away potential collaborators and hinders personal growth. He also discusses the aggressive drive and the pleasure drive, which can become imbalanced and lead to destructive behaviors. When the aggressive drive or pleasure drive is too high, it can result in feelings of envy and dissatisfaction. On the other hand, when these drives are too low, it can lead to demoralization and a lack of engagement with the world. Dr. Conti emphasizes the importance of self-reflection and introspection in understanding one's own drives and motivations. He suggests asking questions about one's level of aggression, pleasure, and generativity to assess the balance of these drives. By examining these aspects of oneself, individuals can gain insight into their own behaviors and make positive changes. He also addresses the role of social media in mental health. He acknowledges that social media can be a powerful tool, but it can also be a drain on the generative drive if it becomes too salient in one's life. He encourages individuals to assess their use of social media and determine if it is contributing to their overall well-being or hindering their ability to engage with the world. Dr. Conti emphasizes the importance of rational aspiration, which involves recognizing one's current state, setting goals, and understanding the process required to achieve those goals. He contrasts this with the desire to possess something without putting in the necessary effort, which can lead to dissatisfaction and a lack of fulfillment. Dr. Conti emphasizes the significance of self-awareness in mental health. He explains that understanding one's own thoughts, emotions, and behaviors is crucial for identifying and addressing mental health issues. He suggests that individuals should take the time to reflect on their experiences and consider seeking professional help if needed. The conversation then shifts to the topic of medication in mental health treatment. Dr. Conti acknowledges that medication can be beneficial for some individuals, but it is not a one-size-fits-all solution. He emphasizes the importance of personalized treatment plans and the need for a comprehensive approach that includes therapy, lifestyle changes, and social support. Dr. Conti also discusses the impact of lifestyle factors on mental health. He highlights the role of exercise, nutrition, and sleep in promoting mental well-being. He explains that regular physical activity can help regulate mood and reduce symptoms of anxiety and depression. Additionally, he emphasizes the importance of a balanced diet and adequate sleep for optimal mental health. The conversation then delves into the topic of stress and its impact on mental health. Dr. Conti explains that stress is a normal part of life, but chronic stress can have detrimental effects on mental well-being. He suggests various strategies for managing stress, including mindfulness practices, relaxation techniques, and engaging in activities that bring joy and fulfillment. Dr. Conti also addresses the issue of stigma surrounding mental health. He emphasizes the importance of open and honest conversations about mental health to reduce stigma and promote understanding. He encourages individuals to seek support from friends, family, and mental health professionals without fear of judgment. The discussion then turns to the topic of resilience and its role in mental health. Dr. Conti explains that resilience is the ability to bounce back from adversity and adapt to challenging situations. He suggests that building resilience involves developing coping skills, fostering social connections, and maintaining a positive mindset. Dr. Conti also touches on the topic of trauma and its impact on mental health. He explains that trauma can have long-lasting effects on individuals and may require specialized treatment. He emphasizes the importance of trauma-informed care and the need for professionals to approach trauma with sensitivity and compassion. Towards the end of the episode, Dr. Conti shares his thoughts on the future of mental health treatment. He discusses the potential benefits of integrating technology into mental health care, such as telemedicine and digital therapeutics. He also emphasizes the importance of ongoing research and innovation in the field of mental health. Thanks for watching. If you enjoyed the video, make sure to like and subscribe.